Officials say the additional vaccine dose should be given 8 months after the second dose of Pfizer or Moderna vaccines. So we're going to bring in our chief health editor, Dr. Partha Nandi, this afternoon. And Dr. Nandi, we've been talking about the possibility of a booster shot for a while. Why is the White House making this recommendation now?
So, Lena, we've been expecting this news, right? Primarily because scientists, right? Science has found that the vaccine's effectiveness starts to decrease, wane over a certain period of time. Another major reason for the booster is the Delta, the rapid spread of the Delta variant, which now accounts for an amazing 98% of cases in the US. Based on scientific studies, the Biden administration feels that the additional vaccine dose will keep Americans better protected against the coronavirus and its variants in the coming months. Now, the FDA, the Food and Drug Administration, still has to authorize this third dose, right? And this is for the general population, but they're expected to do so in the coming weeks. And also the CDC, the Center for Disease Control and Prevention, also has to sign off on the recommendation. This will clear the way for eligible Americans to get a booster shot beginning September 20th. Now, nursing home residents and other seniors, as well as healthcare professionals like myself and emergency workers, will be the first to receive the additional doses. That's because we were amongst the first to get fully vaccinated earlier this year. Mine was in January. Meanwhile, as I told you last week, people with immunocompromised immune systems have already started to get a third dose of Pfizer or Moderna vaccine for added protection.
So, Dr. Nandi, what about the people who received that single-dose Johnson & Johnson vaccine? How does this recommendation of a booster impact them?
Really important. A couple of my patients asked that same questions today, actually. The booster shot, the booster dose is not only recommended for recipients of the Pfizer and Moderna vaccines. Now, that doesn't mean the people who chose the single dose J&J, the Johnson & Johnson vaccine, won't need a booster. The FDA says it needs more data to determine the impact of an additional dose of the J&J vaccine, which rolled out in March and later than the other two vaccines. I like that. I like the fact that the FDA says we need more data, so it's driven by science. Johnson & Johnson is conducting trials, right, on the two doses. Results are expected later this month. The most recent studies indicate that the J&J vaccine provides immunity for at least 8 months and possibly longer. It also appears to provide adequate protection against the Delta variant. Super important. But we just have to wait a little longer to see if and when booster shots of the J&J vaccine are necessary, right? Again, data driven by science. About 14 million Americans have received the Johnson & Johnson shot. So that's really important news that a lot of people are waiting for. But we'll keep you up to date as soon as that information comes.
All right, Dr. Nandi, thank you for joining us.
My pleasure. Thank you.
And if you have a coronavirus question for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter. We'll get it right to him. Brian.